Hello, and welcome back to another episode of Straight Up with Steph. Today, we're talking all about career transitions outside of the operatory. I get a lot of questions about this, and I feel like I'm not the best person to give advice. Yes, I have found a career outside of the operatory, but for me, I feel like it was relatively easy because I had this passion about ergonomics because of my own struggles with it. And it was just a very clear path for me to, I mean, not super clear, but clear enough for me to know what I wanted to do and kind of create my company and create my business outside of the operatory. But I know that that's not the common experience for a lot of people. And they think that maybe they want to do something part time out of the op or leave the operatory altogether, but they do not know how to start or where to start or what to do. And I am certainly not the best person to give advice in that situation. So I decided to look for an expert who is and bring her on the show. Her name is Laura Brenner. She's a dentist and she helps dentists and hygienists transition from the operatory. So she's the best person to give advice on this kind of thing. I hear a lot from clinicians who maybe they've been practicing for a while and they just want to do something out of the operatory, but they're scared because they feel like all they know is clinical, or they're not going to find something that will give them the flexibility, the hours, and the pay that they're used to getting in clinical. First of all, the fact that you are quote unquote just clinical is BS in my opinion, because we have so many skills that we use in the operatory with our patients or with our team that translate very well to jobs outside of the operatory. So don't think because all you've done is clinical that that's all you have to offer, because that's not true. Laura gives us some great advice today on how to recognize if you're burnt out, if you need a change, whether that be just another clinical job or something out of the operatory, and how to get started if you want to do a side gig or a job out of the op. I really like Laura because she's just like a no BS person. She herself shares her story in clinical and how dentistry just was not a good fit for her. She's not scared to talk about it. She's not scared to admit it, which I love because I think a lot of people can relate to that. So if you want to learn about how to transition out of the operatory or just learning what opportunities are out there, please listen to this conversation with Laura. Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Miss Laura. I'm so happy to have you today. Thank you for joining.
Hey, Stephanie, thanks for having me.
It's funny, we both live in the same city, but here we are meeting virtually, but it's all good.
Exactly. We'll have to meet in person one of these days.
I know, definitely. So I have a bunch of questions I want to ask you today because I get frequently asked like how people can work outside of the op or what they can do. And I know that that's what you specialize in. So before we get into how you help people and the advice that you have, I want to hear your story as far as why you transitioned out of the operatory.
Absolutely. When I got into dentistry, I was super excited about it because I thought this was just going to be the dream career. It's kind of what we're taught, right? I'm going to
Yeah.
help people. It's going to be social. And as a kid, I loved going to the dentist. And so I kind of built this dream of what I thought it would be. And then when I got in, I realized that it just broke me down all the
Mm.
time. The first 3 years were a little easier in a way because I knew that my first few years of being a dentist were going to be my hardest years. So I had hope. I was like, if I just get through this, then it will be
Okay.
fine. And then by year three, when dentistry wasn't getting easier and I was still going home every night and losing sleep because I was worried about a patient from that day or a procedure I had coming up or something I said to a dental assistant, anything that happened, and just constantly worrying about it. It just wasn't getting better over time. So, as it wasn't getting better for me, I just lost hope and thought that I need to change. This was in 2004, so it was a while ago.
Yeah.
And at the time, nobody was talking about burnout. So I didn't really know what was going on. I definitely was burnt out. I figured that out years later when I started researching that for some presentations that I was giving. In about 2019, right before COVID hit and the whole world became burnt out, right? We
Yeah.
started learning about it and realizing that back in 2004, I was so burnt out, just didn't know it. So I thought I hated dentistry. And I went to my supply rep and invited him to lunch and said, "Hey, do you know any jobs I can do? Because I don't want to do this anymore." And he basically talked me out of it because he said I was
Oh, really?
overqualified.
Okay.
Yeah. And that was cool. He actually ended up getting me my next job because he was very supportive. He connected me with another dentist who was looking to hire an associate, and it was great. But as he was supportive, it also was another knock, like, you can't change, you have to stay. And so 7 years later, I was still miserable 10 years into my career, and finally at that point was able to leave. But it was a roller coaster of ups and downs through the next 7 years of some days wanting to quit, the next days rationalizing why this was good and it was fine, but really the whole time not feeling like myself and feeling like the work was very painful for me. So finally, my husband was like, "You need to do something about this. Our marriage is not going to survive if you keep
Right,
complaining."
because it carries over into your personal life too, like, it's not just at work.
All the time it carried over into my personal life. And I
Yeah,
was so surrounded by my own misery that I had no idea how it was affecting him. And so
yeah.
that was really the best thing he could have done for me because it gave me permission. And even then, whether you're a dentist, whether you're a hygienist, leaving this profession that you've invested so much in takes time and it's not easy. And that was my case. So now my hope is to, how can I make it faster and easier for other people?
When you were describing your feelings of burnout, I can totally relate to that because when I was full-time clinical, I was up and down with burnout. But again, it wasn't until recently that people started labeling it as burnout. And so I just thought I was a bad person. I'm like, oh my God, I'm a terrible clinician. If I don't want to come to work, that means I shouldn't be working on patients. Like I'm awful. But it's like, okay, it was burnout. Like we all go through it, you know?
Mhm.
Whether you're a dentist or a hygienist or a dental assistant, like why is practicing dentistry so freaking hard?
Well, first of all, can I just say that I love what you said about thinking that there was something wrong with you because I
Yeah.
thought that also. I mean, there was a time where I was like, I hate people. I don't want to work with people. Like, I hate all
Yeah.
people. And that wasn't really me. That was just the experience I was having. So
Yeah.
I love that you said that because if anybody's out there being like, what's wrong with me? It's not. And that's what I love about today is we've got podcasts like yours. We've got Facebook groups and Instagram where people are talking about this stuff so that you can see that this isn't something wrong with you. Yes, it may be something that you can take control of and fix, but it's not
You're not
like,
bad.
oh, I'm totally flawed and bad. Yeah, I'm selfish and
Yeah.
a horrible person. Well, for me, it was difficult because I think part of it is the nature of who the field attracts. At least for dentists, we're attracting very high achiever, perfectionist types who we get to dental school and then it's super competitive and they teach you that every little detail matters more than anything else in the world. And they say things like, once you touch a tooth, you own it, which is a good lesson to teach because they're really saying to us, choose wisely, don't just accept any case, make sure that it's going to have a good treatment outcome, diagnose properly, take care of it. But a lot of us really take that on way too much to mean like, I own everything about this if something happens. So when things go wrong, everything's very high stakes for us. And it just creates this pressure. And here's another thing, and this I would say absolutely would apply for dentists and hygienists is we do this because we care about other people and we want to help them. We put so much pressure on that that if we can't, then we feel awful and we end up really owning other people's problems. And that creates a huge weight on our shoulders. There are dentists and hygienists who don't do that bad habit. They don't see it that way. And they're not going to get as burnt out the way those of us who really carry everything on our shoulders are going to get burnt out.
Do you mean as far as taking other people's problems, do you mean patients? Because I used to do that too. I would
Yeah,
take their lack of health and make it a me problem, and that's like a miserable way to live.
totally. Or if you were doing a procedure and the buccal composite flew out while you were scaling, it wouldn't come out if it were solid and sound, right? It's only
Right.
coming out because there's something wrong with the filling and you know that. But if the patient thinks you did it, you're going to take that on and blame yourself. And even though you know you didn't do it, you're going to be like, oh, but they still see it that way. And then you're burdened by it when it's not really your problem. I mean, it's your opportunity to create a solution, but it's not your problem. I mean, there's a kind of slight distinction
Yeah.
there.
Yeah, I remember when I was a newer hygienist and I've popped fillings out, I've popped crowns off, and it's like, I know logically in my head it's because there's something wrong with that, and so finally I started making the switch and I'm like, "Thank God it came out here versus you at home or on vacation," and then the patient would be like, "Oh, yeah, okay, that makes sense," instead of them being like, "What the hell did you just do?" You know?
I love that reframe. And that's the stuff we have to practice. But now, I'm turning the tables. Did you find that that helped you when you reframed it?
Yes. It relieved me of responsibility because all of us know a crown will not come off unless there's something wrong with it. And yet, when we accidentally pop it off, it's like we take that and we think there's something wrong with us. But yeah, it totally helped. Plus, it's another opportunity to educate the patient. Like good restorations, healthy things don't just fall apart when you touch them lightly with a scaler, you know?
Right. Yeah. And
Yeah.
those are the great things that we learn with time or with having a mentor that really can help. I'd say the big question is, what if those techniques don't help you relieve yourself of that worry and that anxiety and that guilt?
I don't think I would have been able to practice for as long as I did if I kept internalizing that, because I
Right.
remember as a new clinician, I would go home and be like, "Oh my god, this person needs to get this root canal. I know they're not going to get it done. It's my fault that I didn't explain it properly." And it's like you can drive yourself crazy with that. And then finally when I let go, I was just like, I can empathize with them, I can educate them, but it's not my fault if they choose to let this tooth decay to where it's bombed out. But that's an
Mhm.
internal thing you have to work on.
Exactly. And one of the things I've noticed is there are certain clinicians who we all start out that way. Some of them are able to get those techniques and those reframes and learn from it, and then it makes it easier to tolerate dentistry. And then there's another segment of us who, this was, I would say, my case is like, oh, I've seen enough now that I know all the ways it could not work out. So we end up, as time goes on, getting more and more anxious about it instead of being able to use those techniques to calm ourselves down.
I mean, it is hard. I agree with what you were saying with dentistry is like we're perfectionists and we're caretakers. And we usually are on the upper end of both of those things. And so that's a recipe for, burnout and anxiety. And I lecture on substance use disorder. That's a easy road into misusing substances too as clinicians. So yeah, it's a tough job.
Absolutely.
So have you noticed, because I would imagine people approach you because they're burnt out or wanting to learn something new outside of the operatory. Do people usually come to you because of just burnout? They hate their office, maybe it's a financial thing? Like how do people seek you out?
The best fit people who find me are usually people who are burnt out. They don't really like their work. It's not usually people coming to me to say, I want to make more money.
Okay.
It's sort of an interesting distinction because, yes, I promote side gigs, but there's not a lot you can do that's going to make you more money than doing dentistry or hygiene. They're
Yeah.
both like very well paying jobs. Yes, you can make money doing other things, but usually it's like I've realized that the money's good, but I'm trading away so much other stuff that's so important to me. Like, what is it costing me to make this money? It's costing me my health. It's costing me my peace of mind. It's costing me my happiness. It's costing me my confidence. I'm shocked by such an amazing profession that is the work we collectively do is so incredible. And we should be so proud of who we are and what we do and what we're capable of. And I'm shocked to see such an amazing career make so many people feel horrible about themselves. It always amazes me.
Do you think it's a societal thing though? Because we are constantly beat up by the media and people, we're like the butt of jokes and people think that we're sadists or whatever. And it's like, oh my God, we are literally here just trying to help people. Sorry, it's in your mouth and it's uncomfortable, but we are trying to help.
Totally. And even on a more local scale, it's like everybody comes into you and they're like, I hate being here. Not everybody,
Oh
but
God,
you
I
get
know.
one a day is enough. Imagine
Yeah.
being a barista and people coming in and being like, gosh, I hate getting my coffee. Like, even if you know that they appreciate you, they're not directing it towards you. That hurts to hear
It
that every
stings.
day. It
It
stings.
does.
Yeah.
I actually made a video. Oh my gosh, Laura, I got beat up for this video, but it was a joke. You know how I was making a joke about how patients come in and tell us that they hate us. And I, hypothetically flipped the script and I was like, what if we told them that we hate seeing them, that we saw their name on the schedule and we just wanted to call in sick, And it was a total joke, but oh my God. And it wasn't the dental people that were beating me up, it was
Yeah.
patients. And I'm like, you don't understand. Like, we hear this on a daily basis. And for some of us, it really affects us.
I'm gonna have to see that at some point. But that reminds me of my blog post, 10 Reasons Your Dentist Probably Hates You Too, which I wrote in
That is such a great
2000.
title.
Right? I know that was
Yeah.
an accident like a happy accident. And that was because there was a post I saw titled 10 Reasons I Hate the Dentist, and everyone thought that was funny. But when
I
I
bet.
wrote 10 Reasons Your Dentist Probably Hates You Too, everybody in dentistry loved it. But all the patients, not all, there were some patients actually that were like, wow, I had no idea this is what you deal with,
Yeah,
which is so nice to connect in that way
I
because
know.
that's all we want as dental professionals to connect with our patients, right?
Yeah.
But man, the ones that were brutal and just didn't really get it and couldn't see the other side of the story, that is what makes dentistry hard, isn't it?
And those are the people that we're talking about,
Yeah,
you know?
exactly.
Yeah, yeah, but it does. With that video too, I did have a fair number of patients be like, "I had no idea. Like, I'm gonna be nicer when I go in there," and then some of them just went off. But back to burnout and what we were talking about as far as money, I feel like dentists and hygienists in particular, we have great hours for the most part. We make good money. And I feel like some people, they don't enjoy what they're doing, but they cannot see how they're going to have the hours that they want and the pay that they want outside of the operatory. I mean, you already kind of answered it, but do you find that that's true? Or do you find that people generally get what they want and they're happier?
Well, here's the way I love to describe it because I've talked to a lot of different people. And there are some that will say, "Oh, well, career change is easier for you because I'm single and you're married and so you have someone to help support you." And then the married people say, "Well, career change is easier for the single people because they don't have anybody that they need to account for." People who are new in dentistry say, "Well, it's easier for people who've been in dentistry for a long time because they've done it for a while and then they can leave." Whereas people who've been in it forever say, "Oh, it'd be easier to leave if I were," right? So,
Yeah.
what I also have heard is so many people say that there's no way I can make as much money outside of clinical dentistry as I do inside. And then I get on the phone with all these other people who say, I'm watching my friends make so much more money than I do. And not only that, but they got to start right after college instead of spending all these years on dental school. And but one thing I have noticed is if you're a high earning dentist who's making 3, 4, 500,000, which I don't think is the norm, yeah, it's going to be really hard for you to find a job, especially you're at the top of your career and you want to start over. You may have to start a little lower, right?
Yeah. Right. You're going to have to take a pay cut. Yeah.
But for associate dentists or even practice owner dentists and hygienists who are making in the lower, even anywhere up to 150 a year, you can get jobs that are
Mm.
non-clinical that will earn you that or more. It's just our attitude and finding them.
Yeah, and it's really framing it too, and going back to what you said earlier about, like, what are you gaining? Like, you're gaining quality of life and time with your family and your sanity and your health. I try to tell people this. It's like money is not the end all be all. When you're looking at a new office, sure, maybe they're offering you the most that you've ever had per hour, but what else is going on? What's the culture? What are the benefits? Like, are you gonna have to see a double hygiene by yourself? We need to start looking at everything because it's not just about money.
So important.
I stalked you a little bit before this episode, and I, watched a couple interviews that you've already done with other podcasters, which were great, but you said something that really stuck out to me as far as people not really knowing, like, they don't really know what they're feeling. They don't know if it's technically burnout or they're just tired or what it is, and you said that you really like to diagnose and treatment plan people's burnout. So, what does that mean?
That's a fun concept I came up with that I thought we all could
That's
relate
great.
to, right?
Yeah.
Basically, what I have noticed is someone will come to me and everything they're saying points to, I mean, they're saying things like, I'm getting home and I want to crawl into bed. And my husband has to bring me dinner in bed because I'm so depressed that I can't function otherwise. Or they're seeing things like, I'm dying inside doing dentistry. But then when it comes to making changes that are really going to help them, they then say, well, but I want to try to make dentistry better. And that's fine. I'm all for that. And I think everybody should do that because we've all invested a lot to get here. And so we want to make sure that if we're going to change, that it's the right thing. And you want to do everything you can to save your career, which I personally did. However, what I've noticed is when I'm working with people who there's a lack of alignment between their true feelings and what their goal is, they don't show up. They don't
Mm.
actually do the work. And so this is why I think it's really important to get real with yourself and be honest. What is it? Do I really love this work, but I'm in a bad job or the environment, or I need to do it less? Whatever it is, but do I love it and still want to do it? Can I make it better by changing certain things? Then yes, there's an alignment in that action compared to how you feel about your career. But if you know deep down inside that you hate it or you don't like it or you don't love it, but you're trying to fit the square peg into the round hole, it's when people are uncoachable. That's when that happens. They become uncoachable because they're going down the wrong treatment plan. So the diagnosis is really about just being honest with yourself. And then once you do that, then you can create the right solution, one that you're going to be with the right support, at least, that you're going to be willing to do the uncomfortable things and that you're going to be willing to take the extra time when you're tired. But if you don't really want it, it makes sense that you wouldn't invest in that outcome because it's not really aligned. So I just find that the more honest you can be with yourself, the better solutions you'll find for you. And whatever your solution is amazing. It's the best one for you. And it doesn't matter what anybody else does.
Is that something that you help people with then, is really getting granular as far as what they're feeling, what they're experiencing? Because it's hard to be honestly honest with yourself. We play so many mind tricks on ourselves.
Yeah, absolutely. If you could say that I was pretty good at dentistry and I didn't know it, that would be pretty accurate. If I was pretty good at that, understanding the emotions and the thoughts and the experience that go on in here behind this, that's my gift. I'm just going to say it. It's my gift. So I
Yeah.
really understand the dynamics and the feelings and everything that goes with, I understand all the excuses because I did them all.
Yeah.
I experienced it all. And so, yeah, I help people really almost like reflecting the mirror back on them so they can see that what they're feeling is appropriate and what it tells them. And then how can they use that information to empower themselves to make the decisions that really fit in with their lives?
That's so awesome that you just have this innate gift, right? But you've also been through it. And so it's like you can completely relate on multiple levels with people that you help. I think that's awesome.
Thank you.
That's how I feel with ergonomics too. It's like when I'm coaching people or lecturing, I've literally made all of these mistakes. I used to do all of this. So it's like, I get it. I can relate. So when we start talking about side gigs or jobs out of the operatory, I have clinicians reaching out to me and they're like, I want to do something either full time or part time, but they have no idea what they want to do. They don't know if they want to work for a company, if they want to start something. And I'm like, it was easy for me because it was a very personal passion project of mine as far as ergonomics. And so I just went down that road. But if someone has no idea where to start, what do you recommend for them?
That's where I think the soul searching comes in, and that
Yeah.
is what I do with a lot of my coaching, is really helping reflect that back on people and helping them, one, understand what are these rules that they've created for their lives that are holding them back, these unspoken rules, like if you work part-time you're lazy. Like, who said that, right? And that's just a made up thing.
Yeah.
So that's just a silly example, but when you recognize that that thought is guiding you, then you can say, well, maybe I can work part-time hygiene, or success equals money. Like, there's all these rules. So it's like helping
Yeah.
them really get through these blocks that are holding them back. And then after that, it's really getting to know yourself again and understanding through your experiences in life what is important to you. Do the soul searching. What is important to you? What do you love? What do you enjoy? What are your deal breakers? Do you want to work with people? Do you not want to work with people? Do you want a job? Do you want to own your own business? Some of the stuff we know from experience. What are the things you love about dentistry compared to thinking about what you don't love? What do you love? And then how can you translate that into something else? It's not as easy as it sounds by saying, what do you love? It does take a
Yeah, no.
time and soul searching, but an experience and action. And how can you try things that interest you? How can you try them out without it costing you a lot of time or money? So that if it doesn't work out, you don't feel like you're out anything, but instead you've gained information on what is going to be your next pathway.
And it's like these things aren't set in stone either. So if someone decides they want to maybe, I don't know, work for an implant company or something, and then they decide they don't like it, it's not like they failed and they just have to go and do full-time clinical again. It's like that just didn't work out. You learned some, I'm sure, like let's try something else. So I think people get stuck on like if they pick something, they have to stick with it forever. And it's just that's not the case. There's so many other opportunities out there.
I'm so glad you said that, because that's a huge part of it. It's like we have to reframe how it's done. And how it's
Yeah.
done is by allowing yourself to just try something. The consequences are never as bad as we fear they are. Like you said, so what? You go back to a clinical job.
Well, and what a gift it is for us to be able to have a fallback that is
Yes,
so lucrative. And for the most part, it's in demand. Like a lot of us don't have a hard time finding a job right now.
exactly.
I always get curious about this because I'm still clinical and I have noticed a lot of my skills in the operatory. And then I notice some other hygienists that I work with too. They've got like excellent communication skills or they're really great at sales. And a lot of the things that we learn in the op can translate very well outside of the operatory. Have you noticed that too?
Absolutely. And that's
Yeah.
the part that, I talked earlier about I've never seen so many people in such a great profession feel so horrible about themselves. That's
Yeah.
what I'm talking about. It's like, oh, I learned dentistry, so I have no other skills. And
I
it's
hear
not
that so
true.
much. They're like,
All
I'm
the
just
time.
a clinician. I just do clinical. And I'm like, are you kidding me? Like, let's talk about all of the skills you need to be able to do that well.
Exactly. And those are really they're called soft skills,
Yeah.
right? But those
Yep.
are the skills that are more important. You always hear people say, oh, I'd rather hire someone with a good attitude than someone who has all the skills. So many of us are really great people in this industry. We have good attitudes, we care about others, we want to do our best, so we have that to offer. It's just we need to see it first and then highlight it so that we can share that with others, and then that's how you can translate that into non-clinical work. People do it all the time.
Yeah, when I look at those soft skills in the operatory, it's communication, it's multitasking, it's planning ahead, it's being able to pivot, and all of these things they serve you very well outside of the op. So it's like we have a lot to offer, and it just makes me crazy when people just put themselves down before they even try.
Absolutely, I know. There's so many. I
Yeah.
mean, you could go on and on. Leadership, time
Mhm.
management, did you say that one?
Oh,
Organization. I mean,
no,
there's
but
so
yes.
much.
I know, it's a lot. Or technology, I mean, we're constantly
Yep.
adding, like, new things into our day, so what do you wish people knew about working outside of clinical?
Ooh, I like that question. I wish people knew that they're gonna be okay if they go that way.
Yeah,
It's not gonna be the end of the world. In fact, if it's what you want, it's most likely gonna be a better life for you. And, I always like to remind people that I don't care what you do, whether you stay in clinical or go non clinical or leave dentistry completely. I don't care. I just want you to do what you want to do.
yeah, and not limit yourself and think that you can't before you even start. If somebody wanted to, because I know you're a coach, and I feel like that word gets thrown around a lot, coach. Like, I get that too, because I'm an ergonomics coach, and people are like, "What the hell does that even mean?" So, if somebody wants to work with you or a coach to help them branch out of the operatory, what does that look like?
Well, it kind of depends. A lot of my coaching now, I've moved to these small, intimate group platforms
Mhm.
because I've found that this work that I'm describing is very isolating. And I'll just throw out my favorite quote by Brene Brown is that isolation breeds shame. And that's how I felt when I was in the
Mm.
closet about hating clinical dentistry. And I love dentistry as a profession. I just don't want to do that work. I've found that when I bring people together, we're creating these authentic communities where people can really support each other and they're getting much more effective and faster change than people who are really trying to do it alone. So I have one program that really focuses, it's called Let's Go Non-Clinical. We're actually launching in a few weeks. And that really focuses on the strategy of finding a non-clinical job because I've seen so many people do one post on social media or reach out to me for a 30-minute consultation and thinking that that is going to get them the secret to finding the job. And the truth is, I mean, I was just joking about this the other day and I was like, you could go show up to an interview naked for a clinical job and probably get the job. That's how easy it
Yep.
is, you know?
It might even help, I don't know.
Right. But finding a non-clinical job is not the same. It's going to take time,
Yeah.
it's going to take work, it's going to take effort. Let's Go Non-Clinical is teaching people how to just follow the steps, and it's very strategic. It's a 7-week course. My other course is called Start Your Side Gig, which is a much more comprehensive. We're doing a lot of, I believe in mindset, changing your mindset, personal development. If you've got to do this work from the inside out, because if you don't, you're going to always be looking externally for the answers. They're they're other people's answers, not yours.
I feel like that's such a good point as far as mindset because I see a lot of hygienists in particular, because that's who I usually see, and they're burnt out at their office and they want to go to another office. And I was like, you better, I say this nicer, but it's like, you got to figure your shit out before you just jump ship and go somewhere else because you're going to take that with you. And it's like, just figure out what's going on in here, figure out why you're unhappy. And if it's you, you're just taking you with you. A new job isn't gonna help that.
And that is responsibility, which is power, right?
Yeah.
I 100% agree. And that's the thing that's so interesting. You deal with mostly hygienists in your world. I deal with mostly dentists, but do communicate with a lot of hygienists and do work with some of them. It's like we're all the same. There's
Yeah.
no difference between any of us. We all are just people who've invested a lot to get here. We care about the work we do and we want to love what we do. Yeah, so I really focus on that inner work. And then you can apply that to get into the real tangible strategy with ideas. And I would say, if anybody's looking, how do I do it? I would say, get your idea and break it down into really small steps. Like Stephanie, what you do, you started this out with one step at a time. But if you had ever imagined yourself being an ergonomics coach, having a podcast, you probably would have stopped right then. If you imagined your endpoint now, because you'd have been like, how am I ever going to get there? That's so
Yeah,
overwhelming.
no, I would have been absolutely terrified.
Exactly. And
Yeah.
then you stay paralyzed.
Yeah, right, and you don't do anything, and I would still be working full time in an operatory probably, which I do feel like I have gifts in the op, but I have a lot of gifts outside of the operatory, and I would have never explored that.
Yeah. And sharing those gifts, like sharing the gifts that make you feel good while you're sharing, that's what it's all about.
Yeah, yeah, it's very fulfilling. I know that we're about to wrap up, but I have a couple more questions for you. One relates to connectedness, and I read your I think it was maybe your most recent blog post on that. But my question to you is you just mentioned that like hygienists and dentists and probably dental assistants too are all the same. We have the same personality types, same goals, whatever. And yet there is such a disconnect right now in dentistry. Why do you think that is?
It kind of breaks my heart a little bit because I love connectedness. It's so important to me. And it probably has to do with all of the disconnection that's happening with people right now, which probably is about social media and having these important conversations that aren't face to face.
Yeah.
But I think also it does come from that belief that we're othering the other side or the other person. And this is with dentists and patients or hygienists and patients or everybody in the dental office and patients as well. It's like we other each other. And so when we don't see how we're the same, it's
Mm.
easy to kind of demonize them and put that rift between us. But we really do all want the same thing. And if we can, like you said, take responsibility for your part, because the people who are getting through this problem we're having between all of us, they're taking responsibility for their part and trying to see the other person's side as well and opening the doors to communication and really learning how can I connect with this other person and really understand them, and what am I doing to make this situation happen as well.
It sounds like this is what I think too. It's kind of a lack of accountability, but also somewhat a lack of empathy,
Yeah.
in understanding the other person. And it's like if we just take a step back, and it's easy for me because I'm not full time clinical anymore, but I'm like, if you could see how similar like you are to your dentist or your dental assistant, like you guys are all the same, but yet you're just fighting constantly.
Yeah. You know what I
Yeah.
love now that I'm not in the dental office anymore is like some of my best friends are hygienists
Mhm.
and people who are front office managers. And we've all expanded beyond clinical. And what we've realized is those are all just labels and we're all the same.
Yes. Yeah, literally the same. Yeah, no one's above anyone else, like, we're all the same.
Yeah. And by the way,
My last
dentists have a lot of work to do in that too. You know, you said the above thing, right? So we all have,
well, hygienist too,
yeah, all of
like,
us.
I mean, there's a reason why there's the word diva thrown around when it comes to hygienists, like, I've worked with hygienists that definitely fit that mold, but I would say the majority of us don't.
I love hearing that. And really quickly, I'll just say that what's cool about this is you are honest about how hygienists can be, and I'm honest about how dentists can be,
Yeah.
right?
Yeah.
And that's the
Yeah, there's
key.
yeah, yeah, it is, and it's being honest about that, and then also being honest with ourselves with what we're feeling. Last question is someone said this, I don't know, a couple years ago, I can't remember who it was, but they were like, "Dentistry is a great part-time job." Do you agree with that?
Oh, that's going to be a really nuanced answer. I do. I think it's an awesome part time job. Some people get really annoyed with me when I say that because they're usually practice owners who are looking for a full time
Oh,
associate.
they're
And they're
like,
like,
"Don't say
come
that." Yeah.
on. Yeah. But that's what I think is the best part about dentistry. Anything clinical in dentistry, the best part about it is you can do it part time. And so I think, why not? If you go part time and it's still creating anxiety, depression, and all of the pain that some of us do experience, then no, it's not a good part time job. You got to find something different.
It's all about figuring out what's going on up here first, right? And then just
Yeah.
kind of planning things accordingly. Okay. Well, you mentioned your new program that's starting just in a few weeks, and I'll make sure to link that and all of your information down in the show notes. When does that launch?
February 7th.
Okay. Awesome. Yeah, that's coming up. That's awesome.
Yeah, I'm very excited. I had a lot of people reaching out to me asking me how to do it. And I had helped people get non clinical jobs, but never really put it into a strategy or a process. And I was shocked when I created this course how beefy it is. I mean, there's
Mm.
so much material and stuff to do if you really want to find these jobs.
Well, that's a great program too, because we love our checklists and we love little roadmaps on how to get from A to B. So I think that's going to be really successful for you
Thank
and for
you.
us too.
Yeah,
Yeah.
let's create
Awesome.
solutions, right?
Yeah, yeah, definitely. So if somebody wants to reach out to you, what's the best place where they can find you?
Well, I have a Facebook group called Dentist Side Gigs, which is for anybody in dentistry, not just dentists.
Okay.
We do have a lot of hygienists in there. And on Instagram, I'm Dr. Lullabies, so Dr. Lullabies. Or if you wanted to find me online, you could just do your search for 10 reasons your dentist probably hates you too. And that'll bring up my website, Lullabies Career Coaching.
Okay. I want to link that blog. That title is just genius, but I'll link all of that in the show notes so people will find you very easily. And thank you so much, Laura, for joining today. I really appreciate your insights.
Ah, thank you so much for having me, Stephanie.
All right. Thank you, everyone, for listening, and we will see you next time.